Gravity, it is said, has a way of winning in the end. In other words, our ideas are best tested by reality itself. For the Colson Center, I'm John Stonestreet. This is BreakPoint. A recent article in Vice described how certain life-altering surgeries had been deemed non-essential during this COVID-19 crisis. The author was talking about gender transition surgeries, and he worried that in the midst of the COVID-19 pandemic, trans communities are being flooded with reports of postponed and canceled surgeries in the U.S., U.K., Spain, Thailand, and elsewhere, leading to enormous stress and disappointment on top of a global health crisis. Now, despite what the article claims and largely takes for granted, the benefits of so-called gender-affirming surgery, which is a strange name for a procedure that denies one's biological sex, in order to treat gender dysphoria is strongly disputed. The best studies, as I described in a recent BreakPoint commentary, found that medical transition was not the solution to the patient's problems, especially in the case of male-to-female transitions. In other words, such treatment is driven by ideology, not evidence. One of the fundamental tests of a worldview is what I call the test of the real world. In other words, sometimes an ideology looks great on paper, even realistic, compelling, compassionate, but it fails miserably when lived out. Think, for example, of communism. Contemporary gender ideology not only fails this test by failing to deliver the green grass on the other side of mutilating surgery, but also in a way made more obvious in this time of crisis. Reading the Vice piece, it occurred to me just how rare this kind of article suddenly is these days, when just a month ago, these articles were ubiquitous. In fact, in our present crisis, the piece comes across as indulgent and out of touch. While the author acknowledged that medical facilities could soon be overtaxed for everyone, it didn't even mention other procedures deemed non-essential, such as, in Massachusetts, for example, colonoscopies, which can prevent colon cancer and save lives, or hip replacement surgery, which would easily fall into the category of life-altering for someone suffering in chronic pain. The simple, historically obvious reality is that much of the LGBTQ movement is a luxury that only a wealthy, technologically advanced, and politically stable society can afford. Demanding that medical practitioners who were trained to heal and to correct should be expected to amputate healthy organs and alter biological realities, well, that's a prerogative of a society with excess medical resources. A society that can rewrite moral codes and social norms to prevent anything, no matter how slight, that leaves anyone feeling less than fully affirmed, well, let's just say that's pretty rare throughout history. To borrow from psychologist Abraham Maslow's hierarchy of needs, we're that rare people who can take for granted that our more basic needs will be met. Few of us have to worry, really, about food, clothing, or shelter. And the next level worries about physical safety and security, well, those are highly mitigated for most of us. And though loneliness is certainly a growing problem, most of us have basically embraced the idea that family and friends can come on and go on our own terms, at least. See, what's left at the top of this hierarchy is self-esteem and self-actualization. Only societies able to take more essential and basic needs for granted can seriously entertain those worries, much less reframe them as fundamental needs on par with health and basic survival. The COVID-19 pandemic has changed this for the time being. Empty supermarket shelves, the lack of medical supplies, the threat of sickness, even death, they brought more essential and basic needs to the front of our collective attention. Against this new backdrop, demands for self-fulfillment and complaints when those demands aren't met seem petty and small. The reason is that they always were. Times of personal and societal crisis can cause us to see things more clearly. Now, will everyone get the message? Judging by this Vice article, the answer is no. But the rest of us should. For BreakPoint, I'm John Stonestreet.